Hi there, I am going to show you how to do a slump slider. And there's a couple of different ways to do this, so your therapist might give you a slight differentiation to this, but the only way to do it wrong is if you're pushing through the hold. So the goal here is not to make you stretch, it's to actually mobilize the nerves that are going down your back, from your neck, all the way down to your toes. So we don't want to hold. I liken it to if you are going to go up to a door and you knock on the door, but you don't go through the door. You knock on the door, the stretch, and then you turn right around. You don't go through the door. You don't go through the stretch. So let's start pretty simply. You want to be rounded at your back so you don't sit up nice and tall. Some people put their hands behind their back. You can, or not, doesn't matter. You want the head to slowly fall down into a flexed position, so chin towards the chest. You round your back so it becomes like a C shape, whatever's comfortable distance you can go. You keep that position. Now here's where we can differentiate for different people. Some people will say, okay, turn the front of your shin muscles on and lift your toes, and then you'll slowly extend your leg. Then you'll start to feel at some point a pull somewhere in the system. Could be in your mid-back, could be your legs, could be your calf, could be your foot, doesn't matter. If you feel a pull, we want to take that off now. We knock to the door. Point your toe, should let it go immediately, and then lower it down. That's one way. Another way could be that you bring your toes up, keep the round back, chin tuck, slowly bring it up. When you get here, you could point your toe, or you could lift your chin. You might do both. Either way, have you turned the pull off? Then you slowly bring it back down. So I don't actually want you to hold that position. I'm holding it just for demonstration purposes. I'm going to show you what it would sort of look like if you were doing it and you felt that pull. So I bring my chin down, I round my back, I bring my toes up, I slowly bring my foot up. Then I'm going to get to that pull and I lift my chin. Now the pull is completely gone and I let it come back down. You can learn to do it simultaneously. If you know that that's your pattern, to give a little bit of stretch but then give a little slack, you can actually do it at the same time. So you can bring your toes up. As the foot goes up, so does my head. Then when my head goes down, so does my foot. Toes go up, chin was down, chin goes up, toes go up. I could add in the toes, I could not add in the toes. Depends on what stretch you're actually looking for, because everybody's going to be a little different. There'll be the different people who are sometimes it's a little bit opposite. In fact, having the head up as the foot goes up makes it pull. And then you'd actually bring your chin down and then come back. So the head will be up, the foot goes up, and then you get the pull. And by bending your knee or bending your chin, it actually takes away the pull. So you have to do what's right for you. Your therapist will tell you what the better one will be for you. Just make sure you only do it maybe 10 times. Maybe do it on both legs, maybe do it just one. Talk to your therapist, but just don't go past the door. Don't go past the stretch and keep knocking. Don't hold the stretch. Turn right around.